CBC News investigation has found that the Ontario government is paying a for-profit medical clinic more money to perform certain surgeries than it gives to public hospitals to do the very same procedures. Mike Crawley has been looking into that story and brings us his findings.
So this is a private for-profit clinic called Don Mills Surgical Unit Limited. It's in Toronto. And the documents that I obtained through Freedom of Information show how much the province or Ontario taxpayers pays this clinic for each surgery that it performs. Now, these figures never before been made public. There's a whole long list of 70 different surgeries. They're all outpatient surgeries, or what are known as day surgeries. And each one of them is funded at one of three rates, depending on how complex it is. So minor surgery, moderately complex, or higher complexity. And when I showed these rates to four senior officials from different parts of Ontario's hospital system, all four of them said that it is significantly higher than the rate at which Ontario's public hospitals are funded to perform the exact same surgery. So a couple of examples: cataract surgeries, hospitals get a little over $500 for each operation. Don Mills is funded at more than $1,200 per surgery. For arthroscopic knee surgery, hospitals are getting roughly $1,300 to $1,700 per operation. The private clinic is funded at a rate of more than $4,000 per procedure. Now, I've got to mention that all of these figures that I'm referring to cover the cost of the operating room, the nurses, the technicians, the operating room overhead. The amount that the surgeon bills to Ontario's health insurance plan, OHIP, that is completely separate in all of the instances. Now, the Ford government says that the province made a contract agreement with Don Mills Surgical to do more surgeries to basically catch up on the wait lists that had increased because as a result of COVID-19, and agreed to pay them a premium. Here's what I heard from Ontario's Health Minister, Sylvia Jones.
It's really about people having access and making sure that they're not sitting on wait lists, they're not having to wait at home, they're not off work.
Now, the health ministry says hospitals were also paid a premium to help catch up on the backlog. And they say that you can't really make an apples-to-apples comparison about the funding rates because hospitals also get a global budget that covers their overhead. But the hospital officials I spoke to said that even if you take all that into account, it still means the private clinic is getting greater funding. They're also wondering, why should taxpayers be funding the overhead of a private for-profit clinic when they're already doing that in the public hospitals? So there's questions about whether this is good use of healthcare dollars. There was a chief of surgery who I spoke to who called it egregious. Director of surgery at a different hospital said if they were running this clinic and getting paid at those rates, they'd be a millionaire. So the province is moving to increase the number of surgeries and the type of surgeries that are being done outside of Ontario's hospitals. So that's why this comes at an interesting time in this process. The government is looking at doing hip and knee replacement surgeries outside of hospitals, and some private clinics are angling to get a piece of that action, and those are funded currently to the hospitals at a rate of about $8,000 to $9,000 per operation.
CBC's Mike Crawley reporting.